talking about today in addressing social determinants of health, but there's also a real concern about, is there a business case here? You know, and I'm sure in your role you have to think about that in terms of new initiatives.
I think we've all, again, the conversation has been out there for a little bit, and I think you're seeing the product of that in this, I'll say particularly in the mass health integration that's happening right now. The legislature, with the administration, agreed that community had to be built into everything. And that wasn't necessarily the model. That wasn't necessarily the way that folks work. And one thing that I learned in my own district, because, you know, where Dr. Minter Jordan works every single day, she's got the urban housing, the urban edge housing that she's within, but there's also maybe 3-4 housing developments that are around her as well. So for her to be able to have a reciprocal relationship with community-based organizations in delivering care is really important, because there's a lot of folks that live in these places that are really isolated. It is real. There are people that are really isolated in their communities and nobody knows who they are, what their needs are, but we do see them 2 or 3 times in the emergency room. And we do see their family members that are suffering from other ailments and from other issues. So we're having those conversations and we're putting it to the test. So while we're here, I want everybody to realize this work is happening, and it's happening because all of us have been communicating with each other in a really, really meaningful way. The question is, for me, how do we, you know, because there's this bigger conversation, you know, growth is relatively stabilized, Washington is crazy. When people start talking about bending the curve, what does bending the curve really mean to all of us? I mean, that's people that are providing and helping people on a day-to-day basis. And I have to do one thing. I have to make sure that we pass a balanced budget and that it touches everyone here in the Commonwealth for the common good, and that we do it in a fiscally responsible way. We have to have these conversations. How do you bend the curve, but at the same time make the difference? And that's where I'm going to be depending on her, Velma, who just left, Audrey, and so many of you to help me think about this, because I've devoted my life to public health and healthcare for a long time, and I feel like I'm in a really unique position right now in this role of Ways and Means, especially since the budget is so big. And the House budget I felt was very strong in these areas. The question is, how do we make sure that it's sustainable and making a difference?